Well, bone grafting is a kind of a generic term, for many things. Bone grafting can be quite simple, or it can be extremely complex. So a bone graft could be taking bone from the hip or rib, which we, very rarely do today, but certainly something we learned in our surgical training. Or it could be something as simple as taking out a tooth and filling up a socket with no wall defect to preserve the bone. What I think you need to consider with bone grafting is preserving or keeping bone is way more effective and beneficial to patients than trying to rebuild bone. Fortunately, we can do both. If you have a patient that needs a tooth removed or multiple teeth removed, you should seriously consider or at least become familiar with the concept of bone graft and educate your patient about the benefits of preserving the bone that they already have. Today we have some really nice techniques available to reconstruct bones for those patients who were not so fortunate or maybe had a history of trauma. They are becoming more and more predictable. We're using things such as PRP or platelet-rich plasma to allow bone graft to become more predictable or to heal faster or with more density. And with today's bone grafting techniques, sometimes we can place the implant and reconstruct the bone all at one time. And in today's world of wanting everything now, patients really do appreciate that. So if you're not familiar with bone grafting, definitely become familiar with the different types of modalities available. And if you have a patient that's about to lose a tooth, definitely think about preserving that bone.